What is involved in coming off treatment?
Coming off methadone or buprenorphine maintenance treatment, so that's treatment that you've been in for a period of time, is a pretty involved process, and it's not something to be done rapidly, and it is something to be done involving your doctor and other workers and family, other supports that you've got.
For most people who have been on methadone or buprenorphine for any period of time, their hope, and the hope for many people in the service, will be eventually that patient can come off treatment. But it's about picking the right time for somebody to come off treatment. And generally, prescribers are only going to support a reduction in people's dose when there's an evidence that they've stopped using heroin. There's very little point. If you're on 60 milligrams of methadone and you're still using heroin 4 times a week and we reduce your dose, the likelihood of you stopping heroin is virtually nil. In fact, what's going to happen is your heroin use is probably going to go up. So we need to kind of feel that we're not going to make things worse. Generally, trying to reduce your dose at a time of crisis isn't a good thing. You know, if you're finding it difficult to cope without drugs when things are going really well, then generally when there's a whole load of other problems going on in your life, you're going to find it even more difficult. So again, we think the best time for people to reduce is when they're stable, when they're on a stable medication dose, when they're not using lots of illicit drugs, when things in their environment are supportive, not chaotic, and things are going well. And if you want to reduce your dose, the general guidance is the slower, the better. Now, the slower, obviously, also the longer. And so I think what most clinicians should be able to say to patients is that they can reduce at a rate that suits them. Now, if you're on maintenance methadone or buprenorphine and you want to come off, the best thing is to gradually reduce the doses of those medications down. For methadone, we would recommend a reduction of 2.5 to 5 milligrams every 1 to 2 weeks. For people who are on a maintenance dose of buprenorphine, we'd suggest reducing at about 2 to 4 milligrams every 1 to 2 weeks, really depending on how well you go. And you should never be pushed by a prescriber particularly to come off your dose quickly. Although it's very possible to reduce off methadone and buprenorphine completely just through a gradual reduction in dose of those medications, some patients still experience quite a bit of discomfort, and there are a range of medications that we can provide to alleviate some of those symptoms. For example, there's a drug called Clonidine. Clonidine was a drug we used to provide people who had high blood pressure. Clonidine can reduce the sweatiness and the agitation and the palpitations people feel. The concern doctors have about Clonidine is that it can cause people to suddenly drop their blood pressure and they can fall over and they can feel really wiped out. So normally the first dose of Clonidine that people get will be under supervision where they'll have their blood pressure measured before and after a dose. But that can be a drug that helps lots of symptoms. If you can't sleep, the most important thing to do is cut all the caffeine out. Loads of people drink lots of Diet Coke and tea and coffee. That will make your withdrawal worse. Some doctors may be reluctant to prescribe drugs like benzodiazepines, Valium, temazepam to you if you've previously had a benzodiazepine problem. Detoxification works great, and it's quite easy to get people physically clean. However, for many people, the process of becoming dependent on a drug is one that has taken 5 or 10 or 15 years, and it is as unrealistic as having a triple bypass and climbing Everest to think that you can detox and suddenly everything is fine. Detox is the first step, and unfortunately there's a very high rate of relapse following detoxification, perhaps 2/3 at 3 months. So perhaps the most important thing is that if you are thinking about detox, is that you pick a time when things are going well in your life, when you've got support, after a time when you haven't used any drugs, when you haven't got any stresses coming up, and when you've planned it. Generally, those people who jump off treatment suddenly because there's a pressing need and crisis inevitably come back into treatment. And my advice would be, if you want to jump, have a talk with your prescriber and see if you can't negotiate a gradual process of reduction as opposed to jumping off, which is going to make your withdrawal symptoms worse.